Well, to talk more about innovations within the U.S. hospital system, I spoke earlier to Christopher Myers. He's assistant professor and director of executive education at Johns Hopkins University. And I started by asking him how this new form of coordinated care can be defined.
So I think what we're seeing in healthcare today is a recognition that it's not just the treatment of any one particular ailment or illness, but it's rather the ability to deliver care from end to end that keeps the patient at the center that is really driving effective, high-quality care. So we're seeing a lot of organizations move towards thinking about care not as episodic treatments, but rather as part of one integrated whole. And that has led to this focus on the coordination of care and thinking about care from a holistic, patient-centered perspective.
And so for your average patient just kind of walking into their doctor's office or a hospital, what is it that they can get out of that approach versus the traditional clinical treatments?
So I think we're seeing that a lot of these organizations are recognizing that even just that act of walking into the door is in and of itself part of the care process. So we see a lot of hospitals now thinking very carefully about how patient transportation works, for instance. So if patients are unable to get to the hospital easily for a follow-up appointment, for instance, that represents a missed opportunity to deliver care. It's a cost to the hospital and it's a detriment to the patient.
Now, cost is obviously something that always comes up when you talk about care. So in a business sense, how are hospitals benefiting by adding this approach to their existing model?
So I think the hospitals are recognizing this on a number of dimensions. The first is obviously quality and safety. Getting that patient in for a follow-up appointment or treating not just the primary issue but secondary issues is obviously better for the patient's overall well-being. But hospitals are recognizing more and more that it's also an effective way of addressing some of the escalating costs in healthcare. So when a patient doesn't show for an appointment, that's a tremendous opportunity cost as well as direct cost to the hospital. And that cost is often far greater than the cost of hiring a taxi to go and pick a patient up and bring them to the hospital. So they're recognizing that by thinking in more multidimensional ways and thinking more holistically about the patient, they're actually able to manage some of these costs.
So with the hospitals benefiting economically by shifting to this approach, are there any other sort of medical professionals or parts of the industry that lose out when hospitals make this shift?
So I think it's not so much a question of winning and losing. I think it's a question of the evolution of these approaches. So what has yet to shift as much in the industry is the focus on the revenue side. So insurers and other payers recognizing that these services that may not be as directly related to patient care the way we've traditionally defined it are valuable and are worth reimbursing and are worth providing hospitals or clinicians that revenue stream.
Because it's interesting, when people are looking at, how they're going to pay for medical care, the first thing they think of is insurance. The out-of-pocket expenses can be very expensive. So what sort of incentive could there be for insurance companies to even want to try and cover some of these approaches?
The old adage is true that it is cheaper to stay healthy than it is to treat illness. So as we shift to this more preventative mindset and towards insurers taking steps on their own to keep patients out of hospitals or to keep patients from having to go for expensive procedures, I think there's a natural incentive there that's aligned between the patients and the insurers, for instance, covering either preventative care or even outside of the traditional medical realm, covering things like fitness trackers or other sort of proactive health measures.
And as part of that, we're also seeing hospitals taking that first step of really focusing on providing better food as an important first step for patients. Why is that significant?
We now have a growing body of evidence linking things like diet to the outcomes in particular disease processes. So for instance, diet in things like Alzheimer's disease has become a more prominent focus of really strong empirical research. And so recognizing that those things can play a really important role in the treatment of disease, we see hospitals focusing on how to deliver high quality diet alongside high quality care and the more traditional measures.
And are there any examples of countries that are really doing a good job of integrating holistic care into their traditional clinical practices?
So we've seen this broadly as part of a new wave of innovation over the last decade or two in healthcare. as we've shifted away more from making major advancements in clinical techniques and procedures to recognizing that alongside those clinical advancements, advancements in the way that we organize, coordinate, and deliver care have equally powerful impacts on the way that people are treated and the quality of care that they receive. And so in systems where we see more centralization and more coordination. So whether that be through hospital mergers and acquisitions or through more governmental coordinated care, in those larger care arenas, we have seen a strong focus on this coordination because they see more of the benefits rippling throughout their systems.